I just want to talk about an injury that the entire sports world has been talking about. It happened during the championship college game between Alabama and Georgia. And it was specifically, it was a wide receiver by the name of Jameson Williams who sustained a non-contact ACL injury. So we talk about this a lot in our clinic. We tell our patients a lot about it. We tell patients that come in already injured about it. Non-contact injuries generally should not really be happening, right? Again, just a quick disclaimer, there's nothing you can ever do to prevent an injury 100% of the time. Even with preventative training, even with preventative therapy, there's really nothing you can do because an injury can still happen. However, you can try to reduce that injury greatly by actually doing things that are better for the athlete. So when we talk about training and we talk about non-contact injuries, something is giving out, right? There's some kind of a force that's overworking and there's another force that's not working enough. And in this case, what happened with him is that his quadricep muscle, or the front part of his leg, is working a lot harder than his hamstring, which is the back part of the leg. And you have an imbalance. If you watch this, the footage, if you watch the play, he's running, looking back, waiting for the ball to come to him. He catches the ball still looking back, and then he has to kind of rotate forward and start running forward to try to score a touchdown. And at that time, his knee, there's a torsion mechanism that's happening. There's a twisting. He's planted, his foot is facing in one direction, and then that sudden shift and replanting to go forward, it's what actually makes his knee give out. And you could watch that happen. You could watch the wobbling effect on the tissue, on the bone, on the muscles. Again, the main focus here is trying to really work on your posterior chain muscles. Preventatively, in training, with a trainer, on your own, in the gym, or in the clinic with a therapist. You want to focus on hamstrings. You want to focus on glutes. You don't want to be too quad-centric. We do a lot of quad strengthening exercises like squatting, lunging, knee extensions. We focus a lot on the quad in the gyms, and we kind of neglect the back muscles, the hamstrings, the glutes. So the one big takeaway here is that injuries can still happen, but you can do some preventative care. And specifically for young athletes, for ACL risk athletes like football players, basketball players, soccer players, sometimes even running injuries, what you want to do is you want to focus on your glute max, glute med, and hamstring. And we'll put some stuff together so you guys can see what those exercises are and give you some ideas on how to do that on your own. So thanks so much, and thanks for watching.